Hi everyone, Dr. Fink here. Today we'll talk about whether or not you can inject testosterone with an insulin needle or not. Quick disclaimer, this is not medical advice, this is entertainment only. So for those who are injecting testosterone regularly for testosterone replacement therapy, you might notice that there's buildup of scar tissue. It's harder and harder to get into that tissue to inject. The plunger is very hard to push. It hurts your thumbs, and you might have testosterone cough, etc. So you might think, are there any other options for my testosterone injection? And yes, there are. We can use insulin needles instead of those big needles that are recommended by many healthcare professionals. So just keep in mind that we always want to draw the solution with an 18 to 20 gauge needle. So remember that the smaller the number, the larger the diameter, okay? So the faster you can draw. So 18 to 20 gauge is usually for the drawing. So this doesn't change. So now you have your testosterone solution in your syringe, usually a 1 ml or 3 ml, depending on the dosage. And now you want to replace the tip, the needle, and usually what is recommended is 22 to 25 gauge, 22 being very thick, and this builds up a lot of scar tissue because every time you penetrate your tissue with that big needle, you will cause damage in the tissue. Okay, so 25 is a much better option since the diameter is much smaller, causing less damage to the tissue. However, we can also replace it with a 27 gauge needle, which is typically found on insulin syringes. 27 is even less of a diameter and causes less trauma to the tissue, to the location where you inject, especially if you inject over and over again in the same location. Okay, so if you use a 27 gauge needle, you will be able to inject in that location for a longer period of time without building scar tissue. Okay, if you use a 22 gauge needle and you always inject in the glutes, for example, after a couple of years, it will be very hard to inject in that place because so much scar tissue is making the tissue so hard that it is very hard to press the plunger into that tissue. So 27 gauge, a very good option. And you might ask, okay, testosterone N-acetyl or cypionate is an oil-based solution. Can I press it through a very small gauge needle like a 27 gauge? The answer is yes. It will take a little longer than as compared to a 25 or 22, but it is a sweet spot, I think, between the injection speed and the pain reduction and the reduction of scar tissue buildup. Okay, so it might take a little longer, but the benefits of reducing pain and scar tissue are, much better than the 10 seconds longer you might take to inject. So you might ask, okay, can I inject with a 31 gauge needle, which is also typically an insulin needle? I would say that the 31 gauge is borderline. If you can pass it through, if you have enough strength in your thumb to press the plunger, it might work, but you might have to jiggle around a lot and it might take a very long time to press it. So I would not recommend a 31 gauge needle for an oil-based intramuscular injection. So 27 gauge being the sweet spot. So what size, what length of needle should you use? So here I was talking about intramuscular injections, but if you do microdosing and you inject, let's say 0.1, 0.2 ml every day or every other day, then you can also do it sub-Q, okay? And then you would only need, like, let's say half an inch needle, since you don't need to go all the way into the deep muscle tissue. If you do normal dosage, let's say 0.5 milliliters or 1 ml, then, and let's say once per week, I would say 1 inch would be sufficient for most of the patients, especially if you inject in the deltoids, the thighs, and in the glutes. It depends on your body fat. If you have a lot of fat in the glutes, you might need a longer needle, but usually 1 inch with a 27 gauge works great for most individuals for intramuscular injections, and 27 gauge with half an inch for subcutaneous injections with the 27 gauge. Works also great with microdosing. And remember, testosterone, once you inject it, it peaks and then it goes down again. So the more frequently you inject it, the more stable your levels are. So injecting every other day isn't a bad idea, actually. And if you do that subcutaneous with a low dosage, that might work too. But in some people, if they inject it subcutaneously, it creates pocket and causes discomfort. So this also depends on on each individual. So find the right way. Maybe you prefer intramuscular, or maybe you prefer subcutaneous with very small doses. This is something you have to see. All right, so, and what you don't want to do is, for example, take an insulin syringe with a needle that is attached to it and that you cannot remove, and try to poke the testosterone vial and draw with that. It will take a long time. And second, since you cannot remove the needle, once you poke the vial, will get dull or can bend. And this will make it very painful or very inefficient for injections. Okay, so that is not a good idea. Always try to use a syringe where you can remove the tip and change it to another fresh tip when you inject it. Okay, and what you also don't want to do is take an insulin syringe with the fixed tip and then remove the plunger and then basically inject with an 18 gauge the testosterone solution from the backside of the syringe and then pull back the plunger, since this can cause contamination and cause health hazards. All right, I hope this video was helpful, and please let me know what you think in the comments down below, and thank you for watching.